Hi ladies, it's Barbara and I am your menopause drama mama. One of my last videos I said that I was going to do stuff on oral health care again, and this is really important because I have receding gums, and that happened after I went through menopause. So, probably the 5, 6 years in, I started having issues, and I have a lot of deep pockets, and your bacteria from food can get in there. So I'm always deep diving into how to fix this mess. Well, one of them is the benefits of rinsing your mouth with sea salt, and it is so effective, so easy, and you can get it right in the grocery store. And you can also use Himalayan salt. And I have both of them. This one is natural sea salt that I have. And this one is my Himalayan pink salt. This has 82 minerals in it. So both of them are really good to use. But this is why sea salt and rinsing with it helps your oral health. One, it pulls the bacteria out, and that's really important because of those pockets, that you get around your teeth, and a toothbrush just can't get to that stuff to clean it out. Well, when you rinse with sea salt, it creates this hypertonic environment, and all that means is that that salt is drawing the fluid out of bacteria. And so then it is basically dehydrating that bacteria and hopefully killing it completely off, or at least weakening it. This is really important because of those exposed gums, the pockets in there around our teeth. Number two is that it helps reduce inflammation of the gums so you won't get that bleeding. And, as salt water, what it does is it shrinks the swollen gums, and it reduces pressure around the roots of our teeth, and it improves the blood flow to that area around our teeth. Number three is it raises the pH balance of our mouth. And normally, um, our we the pH balance is bad, so it's more acidic. And what sea salt does is it makes it more of an alkaline environment in our mouth. So that helps with what do I want to call it? I guess infections thrive in the acidic environment. So, with an alkaline environment, you will slow bacteria growth. You will help protect that exposed the root area around your teeth when the pockets get really deep, and it will also help support your enamel and gum repair. Now, here is like a picture of what receding gums look like. As you can tell, if you have them, your gums just keep going down, and then your teeth are so much more exposed, and that really will make like that sensitivity really impactful on your teeth then. Also, what it will do is the sea salt water will help gently clean any damaging tissue that you have going on in your mouth. So it's unlike harsh mouthwashes that have, alcohol. So there's not going to be any burning in your mouth when you do a sea salt wash or a Himalayan um, wash in your mouth. And it doesn't disrupt any of the healthy oral bacteria that you have in your mouth, because you want to keep that healthy stuff going. And the fifth thing that sea salt um, is great for is because it contains trace minerals, especially your magnesium, your calcium, and your potassium. And all three of those support tissue repair, nerve cleaning, or nerve calming, and gum strengthening. So that's, really important. Those three things. So if you are not doing like a mouthwash rinse with sea salt, I don't think it could hurt you whatsoever, especially if you are suffering from the receding gums after your postmenopause years. I mean, if you're not comfortable doing it and you want to ask your dentist or your dental hygienist, go right ahead. But I know when I've had issues in the past, my dentist has just told me to rinse with sea salt water or salt water, but I'd say preferably you should either do it with sea salt or with Himalayan salt for the most benefits for your oral health. Um, so also, I'm just going to give you like how much you should use. So in a cup of water, I would use either half a teaspoon or a teaspoon. And then on the way bottom of the water, I would fill it with a little bit warmer water so it dissolves. And then, because obviously, you don't want to rinse your mouth with real hot, scalding water. So just make sure it's a nice warm temperature to rinse with. And I would do it for like 30 to 60 seconds, or I do it at least for 30 to 60 seconds. And like today, I did it in the morning right away, just because, you wake up and you have that, I don't know, that lucky kind of stuff going on in your mouth. So I'll rinse early in the morning, and then I also rinse at night before I go to bed. So I kind of do a double for my oral health right now, because I really do need to fix these pockets that, just don't seem to want to go away in my mouth. Um, but I would say if you do have infections going on in your mouth, you really do have to see a dentist and make sure that you don't have to have any dental extractions or whatever going on. But if you have like pus or you see a abscess, definitely go see your dentist, because you got to get that fixed. But in most cases, you should be fine just using a nice little rinse. Don't have to do it rough. Just do a nice gentle rinse and spit it out in the sink. So that's it, ladies. A good, clean way to do a mouth care for you, and hopefully that will help your um, receding gums. Anyway, I hope you have a great day. Please subscribe to my channel, click like on my video if you liked it, and hit that bell below if you want to get notified of when I do a next video. Um, that's it. Take care. I love you. Sending positive vibes your way. I hope you're having a fantastic day wherever you are in this world. And I hope to see you in my next video. Love you, ladies. Bye. Mwah.